nervous system controls and coordinates all body activity, allowing us to speak, hear, taste, smell, see, think, act, learn, and remember. My name is Anna Golombieski, and I am the nursing educator in the emergency department of a Level 1 Trauma Center. The topic of this lesson is neurological disorders. The nervous system has two parts. The central nervous system includes the brain and spinal cord, which are protected by the skull and vertebral column. It is the central nervous system that receives and interprets signals from inside and outside the body and sends messages back to the appropriate body part or system. The other part is called the peripheral nervous system. It consists of many branches of sensory and motor nerves that extend to all parts of the body. The job of these nerves is to carry messages to and from the brain and spinal cord. Neurological disorders include some of the most disabling conditions and are often chronic and progressive. Conditions commonly seen by caregivers include stroke, multiple sclerosis, Parkinson's disease, dementia, and brain and spinal cord injury. These disorders affect multiple systems. Because they can have physical, behavioral, and emotional components, each person with a neurological disorder has individual needs. Deficits may include impaired mobility, communication problems, vision changes, and personality changes. Because many of these deficits are not obvious, neurological disorders are often misunderstood. This may cause others to feel uncomfortable, leaving the person affected feeling frustrated and lonely. The first condition we will talk about is stroke. Stroke has a cerebrovascular cause and is sometimes called a cerebrovascular accident or CVA. There are two types of stroke, hemorrhagic and ischemic. Hemorrhagic strokes are caused by bleeding in the brain from a ruptured blood vessel or aneurysm. Ischemic strokes are more common than hemorrhagic strokes and are caused by a blocked blood vessel from a clot or from narrowing of the blood vessels. A transient ischemic attack, or TIA, is the temporary existence of stroke symptoms that resolve completely within minutes or hours. Even if symptoms do resolve, the person should get medical attention because a TIA may be a warning sign of a future stroke. Signs of a new stroke or TIA may include sudden numbness or weakness of a portion of the body, sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, or loss of balance or coordination, and sudden severe headache with no known cause. If any of these occur, emergency medical attention should be provided immediately. Treatment must be received as early as possible, and preferably within the first 3 hours, in order to prevent or minimize permanent damage or disability. Chronic symptoms of stroke vary depending on the area affected. It may include paralysis or weakness on one side of the body. A stroke on the left side of the brain causes deficits on the right side of the body, and a stroke on the right side of the brain causes deficits on the left side of the body. Other symptoms may include aphasia, which is the inability to express or understand speech, impaired vision, in which the person is unable to see half of the visual field, perception deficits, where the person may not be able to distinguish left and right, or up and down, or may not be able to tell where the affected part of the body is or what position it is in. Neglect, which means that the person ignores the affected part of the body or things on the affected side. Personality and emotional changes. For example, they may become slow and cautious or quick and impulsive. They may also laugh or cry for no apparent reason and be unable to control these emotions. The goal of nursing care of stroke patients is to maintain the skills and abilities that remain and to try to develop ways to compensate for new deficits. Assistive devices like canes or walkers or bathing, grooming, and eating tools may be helpful. If the stroke affects the dominant hand, the person may need to learn to use the non-dominant hand. When getting dressed, it is helpful to start with the affected side first. Do the opposite when getting undressed. Start with the unaffected side first. Prevent complications of immobility by proper positioning, especially for any paralyzed extremities. Passive range of motion exercises will help promote blood flow and prevent atrophy. Also, adequate nutrition and fluid intake, bathing, and positioning will help to maintain skin integrity. Due to paralysis or decreased coordination, many stroke patients are at risk for falls, so safety should always be maintained. Provide emotional support and promote as much independence as possible. Keep in mind that others may be unaware of unseen deficits like visual changes, difficulty finding words, numbness, pain, and depression. Another debilitating neurological condition is multiple sclerosis. It is a disease of the central nervous system in which the covering of the nerves in the brain and spinal cord becomes damaged and the conduction of nerve impulses is then interrupted. The cause is unknown, but the body's immune system is involved and causes lesions to form along nerve fibers. MS typically occurs in young adults between the ages of 20 and 40 and is 3 times more common in women. There is no single test that can be used to diagnose MS, so several tests and procedures are needed. Treatment involves 3 components. First, it may be directed at the immune system to alter the disease process. Second, specific symptoms are treated to improve function. And third, supportive care, like physical therapy and psychological support, may be necessary to manage deficits. Symptoms of MS vary depending on the area affected and can range from mild to severe. There are several categories of MS. Relapsing remitting means that the patient has attacks of symptoms that last several weeks and then get better. This type may develop into slowly progressive MS, which starts out mild and gradually gets worse over time. The benign type consists of episodes of mild symptoms that never develop into major symptoms or disability. The last category, rapidly progressive, occurs when a patient's symptoms get worse quickly and cause disability in a short time. Symptoms of MS may include weakness and paralysis, muscle spasms, pain, bowel or bladder dysfunction, swallowing problems, visual, emotional, or sensory changes, and cognitive changes like confusion and decreased intellectual functioning and memory. As with stroke, nursing care of MS patients includes interventions to prevent complications of immobility, especially skin breakdown. Preventing infection is also very important for MS patients. Because the immune system is involved, any type of infection may make symptoms worse. Be alert for signs of infection, including fever, fatigue, and worsening MS symptoms. Urinary incontinence and indwelling Foley catheters are common, so it is important to offer frequent fluids and provide good pericare. Adequate nutrition should be maintained by providing healthy snacks and assisting with meals if needed. Be alert for swallowing problems. Offer small amounts on the spoon or fork if the patient is being fed. Add thickener if appropriate, and assess the need for ground or pureed foods. Report any new difficulty with swallowing. Promote independence and provide emotional support by encouraging patients to plan their own activities, diet, and exercise, and to maintain or develop hobbies. MS is an incurable disease that affects most people during the productive years of life, so depression, isolation, and hopelessness are common. Parkinson's disease is a chronic, progressive illness caused by decreased levels of a chemical in the brain that passes messages between cells that affect movement, balance, and walking. Potential causes vary and include exposure to chemicals, head trauma, and heredity, although in most cases the specific cause is never determined. There is no cure for Parkinson's disease, but symptoms can sometimes be controlled with medications. Movement disorders often make others uncomfortable, leading to isolation and depression for the affected person. The symptoms of Parkinson's disease include tremors, rigid muscles, weakness, poor balance and shuffling gait, slow movement, problems with speech, swallowing, and eating. When caring for patients with Parkinson's disease, assisting with ambulation may be necessary. Encourage lifting the toes and bringing the heel down first, swinging the arms, and standing straight. Be patient. Speech and movements may be slow, but intelligence is not affected. Be aware that timing of medications is essential to maximize their effect and to decrease side effects. Symptoms may be worse if the medication schedule isn't followed precisely. Be alert for hallucinations. While they are not part of the disease process, they can be a side effect of some Parkinson's medications. As with the other neuro disorders, prevent complications of immobility. Parkinson's patients also need emotional support and encouragement. Remember that family members and others may be uncomfortable with the movement disorders and avoid the patient. Dementia is another neurological disorder that we will cover briefly because it is covered in more detail in other lessons. It is the gradual decline of intellectual functioning and cognitive ability. Dementia is associated with structural, chemical, and functional abnormalities in various regions of the brain. Symptoms vary from mild to severe and may include memory loss, disorientation and wandering, impaired judgment and problem-solving skills, the need for reminders and assistance with activities of daily living, and delusions or aggressive behavior. When caring for patients with dementia, a calm, non-stimulating environment is helpful. Provide simple cues, a structured routine, and constructive diversional activities. Avoid complex vocabulary. Remember that overstimulation, changes in routine or environment, and tasks that are beyond the person's ability can trigger agitation. Family caregivers should also be given much emotional support. Spinal cord injury is a common cause of disability among the 18 to 35-year-old age group. This occurs when injury causes permanent disruption of impulses to and from the brain. Common causes include motor vehicle crashes, falls, violence, and recreational injuries. Spinal cord injuries are defined by the level of injury which is described by the surrounding vertebrae. For example, a C2 injury is the second vertebrae of the cervical region, and a T10 injury is the 10th vertebrae of the thoracic region. A quadriplegic has paralysis of all four extremities and the trunk. A paraplegic has paralysis of only the lower extremities and the lower trunk. The degree of damage may be complete, meaning that all functions below the level of injury are lost, or incomplete, meaning that some functions are lost but others remain intact. Symptoms depend on the level of injury and the degree of damage. Some examples are paralysis, loss of sensation, meaning that the patient cannot recognize pain, temperature, or location of body parts, muscle atrophy, bone weakening, slower digestion and elimination, bladder and bowel incontinence, and impaired respiratory muscles with injuries above T7. They may have shallow, ineffective breathing and be unable to cough or sneeze, putting them at risk for pneumonia. Nursing care of patients with spinal cord injury should emphasize prevention of complications of immobility. Proper positioning and repositioning is very important. Maintain skin integrity through adequate nutrition and fluid intake, as well as bathing and repositioning. Active and passive range of motion exercises should be done as appropriate. Assess skin carefully. Remember that the patient may not be able to feel pain and temperature, so they won't know if they have bruises, burns, or pressure ulcers. Prevent respiratory complications by repositioning and encouraging coughing and deep breathing if the patient is able to do so. Explain cares and be reassuring. Because they cannot move or feel some parts of their bodies, Patients may have a fear of falling due to their inability to protect themselves. Promote independence by allowing the patient to have control whenever possible, and encourage the patient to assist with repositioning and self-care. Traumatic brain injury is another common cause of disability in the 18 to 35-year-old age group. It is damage to the brain caused by an external force, as can happen with motor vehicle crashes, falls, and assaults. Symptoms depend on the area of the brain injured and may include difficulty coordinating movements, headache, memory problems, fatigue and sleep disturbances, difficulty organizing and staying on task, word-finding problems, personality changes, and anger or depression. When caring for people with traumatic brain injury, be patient and allow them extra time to complete tasks. Routine and structure are helpful. Cues, like notes or pictures, for how to do daily cares or other activities can help to promote independence. Be supportive of family and other caregivers. To them, the patient may seem like a different person due to personality and cognitive changes. I have explained some of the common neurological disorders that caregivers may encounter. Keep in mind that they often cause significant and life-changing disabilities for both the patient and family members. Along with preventing complications and promoting independence, emotional support and encouragement are essential to positive outcomes.